Well, hello, everybody, and welcome back to the podcast. Today, my very special guest, once again, is Dr. Howard Schubiner. Welcome back, Howard.
Hello, thanks for having me, Wayne. It's always a pleasure.
Excellent. So Dr. Schubiner is a professor of internal medicine in Michigan, and he's got a real big passion for figuring out how to heal pain, and he's been in this business specifically for about 20 years after spending some time with the one and only pioneer John Sarno. So Howard, what we're going to talk about today, I thought initially we'll dive into the subject of this post-COVID era that we're in to keep it topical, because I know you've got a few things to share about that.
Yeah. Well, how many times do we get to live through a global pandemic? Hopefully not too many. But the amount of fear that this has created and the amount of suffering and the amount of pain and the amount of conflict that this has created all over the world and in so many families is wreaking havoc on our mental health. And our mental health is intimately related to our physical health, right? And so what we're starting to see is that roughly 10% of the people who've developed COVID have this so-called long haul COVID or post-acute COVID syndrome. And the symptoms of this seem remarkably similar to the kinds of symptoms we in mind-body medicine see and treat every day. Fatigue, brain fog, trouble concentrating, aches and pains, no energy, anxiety, depression. And all of these things are, real, but subjective symptoms. They're not diseases in and of themselves.
Yeah.
And many of the people who are suffering with this so-called long haul COVID syndrome, about a third of them actually didn't have COVID or don't have any positive tests for COVID in the first place, which makes you begin to see that it is possible. And we can't say for sure yet, and we don't know for sure. I mean, there's some people who had COVID who have lung disease from severe pneumonia, and they have, ongoing lung disease or heart disease, who have been really sick and inpatient and ICUs and ventilated. But most of the people with the long haul COVID were not in the hospital, were not very sick. They didn't have severe disease. And so it's easy for us to see how the brain could generate symptoms like all these that I described out of fear and out of worry and out of stress. And these symptoms could then be perpetuated by this vicious cycle of the symptoms leading to more fear and worry, more reading about it, more concern that you'll never get better, and then the symptoms get worse over time. So that's something, and I've started to see a few people like this. And again, I can't say for everybody, but the people I've seen and the data to me suggest that the majority of these folks can recover and do not have an immunologic disorder or some kind of disease state. Anyway, that's what I've been thinking about.
Excellent. And I think you brought up a real core point that, mind-body medicine, and when really it's real medicine, because we are human beings with a mind and a body and a spirit. And, that's what we should be focusing and treating. And I know that's been your line of work for a couple of decades now. So this mind-body, which part of the brain do you think is responsible for this mind-body control center that you're talking about?
Yeah, that's a great question. The neuroscientists that I've talked to, I remember I wrote a chapter on the neurophysiology of what I call neural circuit pain or neural circuit disorders or mind-body disorders. And I kept wanting to say, well, it's the amygdala and it's the anterior cingulate cortex and it's the insula and it's the dorsolateral prefrontal cortex. And he just kept saying, well, it's really the brain. It was disturbing. Like, he's the neuroscientist, right? It says, well, it's the brain. And it's because these are circuits.
Yes.
They involve a lot of separate areas of the brain. And in our Boulder back pain study, we did fMRIs of the brain pre and post in people with back pain.
Yes.
We found that there were some distinctions and there were some changes in the brains pre versus post in terms of areas connected to the prefrontal cortex and the insula in particular. But they're really circuits. And so, the attempt to find the pain center, it doesn't exist.
Exactly. And is that beyond the limbic system? Because for our audience, the limbic system is the central part of your brain. It's behind our eyes, and it's a huge area, and it controls areas for memory and learning and thoughts and emotion, and the control of the autonomic nervous system, the endocrine system, and the immune system. Like basically the whole thing is controlled in the center. But I'm just wondering, what about that cortical area, the bit in the outside, the neocortex? Is that also part of this as well?
Yeah, I think so, because first of all, you have obviously the connections to the somatosensory cortex, where the connections to the muscles and nerves and sensation are out throughout the body, the homunculus, so-called.
Yeah.
And plus you have in the frontal, the prefrontal cortex, which is more of a cortical area that has influence over the limbic system. And those connections are particularly, I think, important when you think about the prefrontal cortex and the kind of limbic system, because those are, it's moderating that viewpoint. And so it's kind of like, in a way, it's almost like the conscious and subconscious, because we're thinking consciously in our prefrontal cortex, but the subconscious part, the limbic system, is acting and controlling our breathing, like you say, and our heart rate and our bladder and our stomach and all of our muscles and our balance.
Yeah. Okay, that's good. That's good. Thanks for reminding me about that, because I think it is the brain, let's face it. And
yeah,
it's the whole thing, right? It's being programmed. Okay, so our COVID environment has been training us to be a different type of global community for over a year now. And you were seeing these changes, and you're seeing these changes. So what is, the pain thing? Is it just another pain presentation? Like, let's face it, life is full of pain, life is full of suffering, life is full of challenges. That's what we get from the moment we are born to almost the moment we're dead. And it's a challenge, right? And we get programmed. And we need to reprogram ourselves out of that. So is this just another program?
Yeah, I think so. And the people who are more likely to develop these new symptoms are people who've been programmed in the past to be more sensitive, to be more caring about others, which are good qualities, of course, to be less assertive, to hold their feelings in. People who've been programmed to by neglect or abuse, unfortunately, some of the time. So their brain is sensitized to danger.
Yes.
And so, if your brain quickly goes to danger when, a black cat crosses your path, or when a car comes too close, or, when you read the news about some new horrible tragedy that's going on, which is almost every day, the brain, the subconscious part of us, tends to go into this fight or flight mode, tends to go into this danger mode, and it can set up a danger signal. And we know from the neuroscience, it's very clear that the danger signal can respond with pain, or with insomnia, or with anxiety, or depression, or fatigue, or brain fog, equally well. All those things the brain is very good at producing those messages, those alarms, like a smoke alarm going off. And, as physicians and as people, we have to understand that not every symptom is due to a physical, damaging structural problem. In fact, it's clearly my view that the majority, really the vast majority of people with chronic pain, with chronic fatigue, with chronic insomnia, with chronic anxiety and depression, the vast majority of those people do not have a structural disorder that needs medication or injections or surgery, procedures, but needs reprogramming of their brain, resetting, rewiring, calming the nervous system, calming the brain, and realizing that the message is important, but the message often means that we can interpret the message for what it is. We can understand that the message might not be you have a broken arm, but you have a broken heart, or you have or you just have a tremendous amount of fear about the future and about what this pandemic means and what it means to you in your life with your kids and your family, you know, and all those specific things.
Yeah. Okay. And let's move on, because it ties in with the pain, because we know, both of us in our practice, we're helping people all the time get out of this mind-body trap, this program. And tell us first about the study you were doing with a colleague who was in Colorado, who's moved on. But because when you shared that with me in a previous webinar, it blew me away, and I started to implement some of the stuff you were saying about the study. I thought, oh my gosh, I've got to do this. So yeah, let's talk about the study first, just the results and what that's applicable for our audience.
Yeah, this Boulder back pain study has not been published yet.
Right.
So we're not publicizing the results too much, but I can say that it was a randomized controlled trial of people with chronic back pain. And people with these people had approximately or average of 10 years of back pain. And they were assessed, and there was 50 people in each of the 3 arms of the study. One arm got a treatment as usual, no special treatment. One arm got a back injection, and the third arm got this mind-body treatment that we're talking about. And of the 50 people randomized to the mind-body arm, I personally evaluated 45 of them virtually, and I determined that I was certain that 43 out of the 45 did not have a structural problem in their back, even though they'd had back pain for approximately 10 years.
Yeah.
So they had, quote, mind-body pain, real pain, not imaginary, not in their head, not fake, but not due to structural.
Yeah.
And we assessed that, and then I turned them over to our 2 great therapists, Alan Gordon and Christy Weepy, and they helped teach them that they could calm their brain, teach them how to calm their brain, teach them how to separate from the fear of the pain, to begin to think of the pain as a neural circuit in their brain and not something structural.
Yes.
And to give them exercises so that they could see that the pain would frequently shift a little bit or move or get better or worse while they were just watching it. And then that began to show them, oh yeah, it does change. Oh, look, it went away for a second. Oh, look, it came back. Oh, it moved. And they're going like, why is that? And you say, well, that's your brain. And then once they had that realization, they could practice those techniques. And 75% of them were pain-free in 1 month. I mean, that's astounding.
And pain-free in a month, 75% of this group that you are doing. And what about happened to the group 1 and 2, the ones that had no real treatment or extra treatment or the back injections?
They had those 2 groups had similar reduction in pain, which was much, much smaller.
Okay. So we're not talking about the details. Okay, good. Excellent. So basically the group that was practicing this, and what were they doing every day to help this reduction?
They were practicing. The thing is that what we teach is the problem is not the pain, the problem is the fear of the pain or the worry about the pain or the focus on the pain. So when they would get pain, they would use that as an opportunity to practice taking a breath and saying, oh, that's my brain.
Okay.
Right? Stepping back and just observing that and saying, well, I'll just keep walking. Okay. I'm okay.
Yes.
I'm okay. I'll keep walking. And then gradually their brain calmed down this danger signal in the brain, this circuit that was turning on pain.
Right. Excellent. So basically just addressing it as they walked through their day, literally.
Yeah. And
just calm down the fear, calm down the brain, or the amygdala, or we'll just call it the brain now. Calm down the brain. And therefore they were able to tap into other areas of the brain that brought more regular life without fear.
Yeah, you turn off the danger signal by making an accurate diagnosis and helping people know that they're not damaged.
Yes.
You turn off the danger signal by educating them about the fact that the pain is real and it's being caused by neural circuits in the brain, so they're not in danger. And you turn off the danger signal by helping them reduce the fear and the focus on the pain. And you turn off the danger signal by helping them move toward joy and smiling and humor and play and laughter, which activates the circuits of the brain that are antithetical to the danger signal, because you're feeling safe.
Yes.
When people feel safe,
right,
their brain will turn off these danger signals, and that's the key.
Feeling safe. Yes, the opposite of fear.
Exactly.
We've all got to feel safe. Yeah.
And some people need to address some of the emotional issues in their life as well, because these things didn't come out of nowhere. You know, they came out of stress and trauma, which is why COVID has produced these kinds of symptoms in people. They come out of stress and trauma and emotional disorder. So sometimes you need to work on those as well, and deal with the underlying stress or the underlying emotional disorder. Sometimes you need to change your situation. Sometimes you need to move all the way from Canada to Scotland.
Oh, there you go. Yeah, absolutely. Sometimes you need to do things in life to change, to make things better.
Sometimes you need to make a change.
Okay. So, you know, when I listened to what you had to share, and I just started implementing it in my practice. So how about we do a little, you know, for the purpose of our audience, pretend that you're the patient and I'm the doctor. And I'll just take you through what I do, and I'd love your feedback to see what you think about it. And maybe you can give some tweaks. And I added a little bit extra in the last couple of weeks as well, which I thought would bring a bit more holism to the statements that we say.
Yeah. Okay, great.
Let's do this for about a minute. So if anybody listening, make sure you're comfortable. Do not do this while you're driving, please. Make sure you're comfortable sitting in a chair or lying down if you want. So here we go. So first, just say the statements: I am safe.
I'm safe.
I am completely healthy.
I'm completely healthy.
I am loved.
I am loved.
And I am loved.
And I am loved.
Now, I'd like you to close your eyes, Howard, and just go to a place or a time or a person that you feel safe, loved, or completely healthy. And I'd just like you to tell me where you are.
I am on a beach at our cottage.
Wonderful. The most common place people go.
Yeah.
And how are you feeling on the beach?
Just so relaxed, so calm, at peace, and happy.
Wonderful. Now, I'd like you to take those feelings and I would like you to multiply them by 2.
Okay.
Wonderful. Now take those feelings and multiply them by 2.
Okay.
Wonderful. Now we're really going to reach for the stars, and we're going to do it once more time. Multiply by 2.
I'm floating above my chair.
Wonderful. Now repeat the statements after me. I am safe.
I'm safe.
I'm completely healthy.
Completely healthy.
I'm loved and I am loved.
I'm loved and I'm loved.
I'm safe and I'm completely healthy.
I'm safe, completely healthy.
And I'm loved and I am loved.
I'm loved and I'm loved.
Okay. Well, thank you so much. And I just report that many patients actually can reduce their pain to 0 at this point. And I've just done it for a minute, probably.
Makes you think I'm coming back to this podcast?
Well, welcome back. And almost every patient gets at least a drop of 1 score, and there can be other reasons for that. And I find with this that the ones who struggle, now you've done this many times, you know what you're doing, but many people can't do this. Like, they can't focus, they can't find a place, they can't increase the feelings. And I think, well, this is good, because they're the ones that really need to do it, right? Because there's these blocks to get safe and to feel love and these emotions. And
I think the one thing that makes this, in my view, makes this work more successful, particularly successful, is when the patient doesn't feel like they're lying to themselves.
Right.
And so when I ask people to say I am healthy, and when I ask people to say there's nothing wrong with me, I tend not to do that at the beginning of a session, because they would think there is something wrong with them, and they feel like maybe they're trying to trick themselves or lie to themselves.
Right. Okay.
So I think that can create some conflict if we're saying, you say you're healthy, and their feeling is, no, I'm not. I have this degenerative disc in my back, or I've got this neuralgia condition or whatever that my other doctor told me. And so that conflict can create tension that may not allow them to actually feel safe and have the effect, that you're looking for.
I think the purposes of our audience, that's absolutely true. And, that's a huge take home. Like, they need the education, and there needs to be preparatory work almost done. I find with my clinic clients, I'm on Zoom with them all for half an hour. I've got their education with videos, and I've got them doing all this stuff, and I'm embodying the concept that they can heal and they can get better. So by the time I get to this visit, I've already seen them once. And so they met me in person. So we're kind of 2 hours into the journey here. And then I say, right, we're going to do this. And I just find that people are so desperate to think that, they could get better, right? They're just so desperate, and the hope comes back to them. So I think my personality, and I think, the fact I've been doing it a lot, it's so many factors involved here. It's not quite just one little exercise, but.
Oh yeah, absolutely. Well, it's caring. I mean, you feel safe when you're in a caring environment, when you feel cared for.
Yeah.
And so that is a huge component of helping people turn down the danger signal.
Yeah.
The other component is some people don't feel loved, or they don't feel that they feel isolated or alone, or they've been traumatized in romantic relationships or partner relationships. So, obviously people are complex, but, I think everyone can learn to move at least a little bit towards safety.
That's right. Awesome. Okay. So what do you do in your practice with this?
Well, I screen people. I ask people I have a specialty practice, so it's not a primary care. So I see people specifically for mind-body disorders, and I ask them to do some reading, watch some of the videos ahead of time. I made some animations you might be interested in. Yeah, there's 6 animated videos that a friend of mine, Dr. Saurabh Galagally, and I put together. And they're on my website, has a link to them. And they're great for patients to watch, I think, or I hope they will be, because they're 4 to 7 minutes or so, explaining the brain, explaining pain, explaining how to understand these conditions. So anyway, that's a resource that I ask people to look at. And then when I see them, I schedule a long visit. My first visit is 2 hours, which is a huge luxury.
Wow.
But I go through their whole life history, the history of all their symptoms, and give them a lot of education. And then I begin to start working on this feeling safety once I can accurately, which is usually the case, accurately diagnose them as having a mind-body rather than a structural condition. So I'm doing all that, and then I'm getting to this point where I'm doing mindful awareness, or what we sometimes call somatic tracking, or ways of helping people calm the danger signal in their brain.
Mm.
And then I'm giving them exercises and meditations to do at home so they can practice that. And then some people do great with that. And then, like I said earlier, some people need some emotional processing work.
Yes.
And so sometimes we're doing that at the second or third visit. And I use my book. I have a book, as you know, called Unlearn Your Pain, and one called Unlearn Your Anxiety and Depression. And those are workbooks that can guide people through this process.
Mm-hmm. And what's the other book we mentioned before with Allan Abbass?
Oh, yeah. There's a book for professionals that Allan and I wrote, Allan Abbass at Halifax, who's a fantastic, brilliant teacher and leader and the researcher in the world on short-term dynamic psychotherapies, emotional processing type of therapies. And the book is called Hidden from View. It's a small book for professionals on how to do this work.
Excellent. Well, it's definitely on my hit list. I've got to dive in. You've reminded me at once already about that. So I've had it for a long time as well. Anyway, I loved Unlearn Your Pain. I had that for several years, and I went through it myself, as I generally do, and then start to use it with patients. And it's a deep dive into our life. It really is, and unturns those stones that need to be unturned and starts that healing process, safety process.
Well, sometimes people can really benefit from
Yes.
this work, not only in getting their symptoms better, but in understanding how they got here, understanding what their life has been, and understanding that they can change,
Mm-hmm.
that they can improve how they treat themselves.
Mm-hmm.
Starting with that, how they treat themselves, because so many people have learned to be unkind to themselves by people being unkind to them.
Mm-hmm.
And when people can learn that it's okay and given techniques for how to be caring to themselves, which is what you're doing in this brief thing, you're teaching people to care for themselves.
Mm-hmm.
Right? And that's a huge gift, that people can use this as a springboard to improvement. You can have post-traumatic stress disorder.
Mm-hmm.
But you can also have post-traumatic growth. You can use stress and trauma as a springboard to growing.
Yes.
I mean, that's a beautiful process people can do.
Yeah, I find in life, the people that go really low, it's like a wave. If you go really low in the wave, there's a really big crest coming afterwards.
Yeah.
And not everybody can make it, though. I've also learned that it's a sensitive issue. It really is. But yeah, it's almost fertile ground for growth. And
it's laying you out there. You're kind of exposed and vulnerable.
Yeah.
And when you're vulnerable, you can get run over, stepped on, or you can get a helping hand and lift yourself up.
Yes, exactly. Yeah, anything else you'd like to talk about today, Howard?
I just want, I think, people to understand that our brains actually control how we see, how we hear, what we feel.
Yes.
And it's a really important, I think, field of neuroscience called predictive coding. And so, what I tell my patients is you can't understand pain or anxiety or fatigue unless you understand how the brain works. And our brain works, how we see is not just from what our eyes take in. Our visual cortex processes the images that come into our eyes, and it creates the images that we see. And a lot of times we see things that may not be there because our brain is expecting something. And we hear things, or we mishear things, or we missee things that our brain gets confused, and it takes a shortcut. And that's how our brain works. And the same thing happens with sensations in our body. So not every sensation in the body that we feel is generated by a physical problem. So our brain is constantly creating what we feel. And this is really counterintuitive. It's hard for people to get that when you touch a hot stove, it's not your finger causing the pain, it's actually the brain. I mean, that is a really difficult concept. But when people begin to understand that, they can begin to learn that their brain controls what they experience. And feeling safety or endangered in their bodies or safety or endangered in their lives affects how our brain puts out the experiences that we experience every day, every minute of every day. And that, I really, on a philosophical level, I really think it's important for people to understand that. And the other thing is that emotions are real, and emotions have physical phenomena that occur in the body. And so if we're angry or afraid, we can feel that in our body. If we're sad, we feel that in our body. And these are visceral things that we can begin to learn and understand that emotions are not dangerous. It's healthy to be angry when anger is appropriate. It's healthy to be sad when sadness is appropriate. It's healthy to be afraid when fear is appropriate. And we can teach our brains to learn to tolerate emotions and embrace them. And one of the things I think that kids should have in their bedroom, especially teenagers, is a little whiteboard. Your kids may like this. And on one column it says things that make me sad, things that make me mad, things that make me glad. And we can teach kids that all these emotions are healthy and normal. It's normal to be happy. It's normal to be mad. It's normal to be sad. You can write about it, and you can write down those things, and you can process them just by writing and by making the subconscious conscious. So anyway, those are a couple of things that kind of on my mind these days.
Awesome. Well, I thank you for your wisdom. I thank you for your passion in this subject and bringing it all together, and your studies and your language that you've used to describe it as well, because we all talk slightly different based on our background. I appreciate that.
And if you want to, and if people are interested in the role of emotions in pain, there's a movie that is just out now called This Might Hurt.
This Might Hurt. Okay.
Yeah. And it's you can access it at thismighthurtfilm.com.
Okay.
And it's a movie made by two young and passionate filmmakers who went into great debt, great amount of expense and time to make this movie, and it just keeps coming out this year. And there's virtual showings of it every month at their website. And it's a movie that was involving the work that I've been doing at my hospital with some of my patients, and watching patients go through the process of dealing with their pain and dealing with the emotional issues that underlie it. It's very moving and compelling stories.
Wonderful. Well, I'm sure our audience can plug into that. It's an excellent way to just connect, because it's such a huge subject. And I think in our traditional conventional medicine, it's just not, it's almost too complex to get. Now, we know it's not, but even listening to what you're doing and your path for 20 years now of getting to this stage, it's like, how does the traditional model, how does the traditional system get to where we're at and practicing as we do? So I don't know the answer to that question.
There's a lot of unlearning that needs to be done.
Right.
Like we do a lot of work with physios or physical therapists.
Yes.
And they've been trained to look for all these subtle variations. The hip is higher, the leg is longer, the hamstrings are tight, the abdomen isn't strong, the core isn't strong enough, there's a shift in this or that, or there's a scoliosis, or all these things that are more likely to be the result of pain rather than the cause of pain. Or more likely to be incidental findings. We're now diagnosing people so often in this world with Ehlers-Danlos syndrome and attributing chronic pain to this genetic disorder that causes joint laxity. And I don't believe that joint laxity causes pain, but we're latching onto this as a cause because so many people have pain and we don't know the cause. So we're latching on to these minor variations and giving them more credit than they deserve for causing these problems. And people are starting to fixate on those and thinking they need to fix those, which just makes things worse. So this unlearning some of the stuff that we thought we knew is hard. It's hard to unlearn something you thought you knew. Hard to change your mind. You know, I don't know how successful you are at helping people change their mind about religion or politics, but
oh, that's my night job. Oh, well, listen, good to talk. Good to see you again, and thank you for coming on the show. And I welcome you back in the future sometime. We will always more to talk about.
Thanks, Wayne. I really appreciate it. Thanks so much.
Thank you. Take care.
Take care. Yeah. Bye.